Hi, this is Dr. Mark Sehl of the YouTube channel Therapy for the Heart, and today I'm going to talk about on choosing a psychotherapist, psychoanalyst. Who practices psychotherapy and psychoanalysis? I'm going to talk about New York State. If you're in another state, you can find out who practices those disciplines and if they're licensed or if they have to be licensed. But in New York, it used to be only social workers, psychologists, and psychiatrists that practice psychoanalysis. Psychiatrists tried to have control over the field. Then psychologists were able to join the club. They fought hard for that right. And also then social work psychoanalysts followed. Now in New York State, people don't need one of those degrees to practice psychoanalysis. As long as they have a master's degree and complete a state-accredited training program in psychoanalysis, as long as they do that, they can proudly practice alongside other licensed professionals. And lay analysts have fought long and hard to have that right. And Freud said that there was a problem about being a medical profession doing practitioner doing psychoanalysis. He said you have an advantage in being a lay analyst, but other people didn't see it that way. They wanted to have control. The medical profession wanted to have maintain control over the practice. So now we are free to practice psychoanalysis. I have been free for a long time because I obtained a certificate from a licensed, accredited training program in psychoanalysis many years ago, and I am a member of the International Psychoanalytic Association. And still I say that you don't have to have certain requirements to practice psychoanalysis, one being frequency of sessions. I've been in therapy four times a week, and in psychoanalysis. I've been in psychoanalysis once a week. It's not related to how frequently I went. It was related to how I was as a patient and who the practitioner was that was treating me. Also, there's a large group called mental health counselors and also marriage and family therapists who practice psychotherapy but may not practice psychoanalysis. It's very confusing who does what, but you can Google it, who practices psychoanalysis, who can practice psychotherapy, and you'll find out some more elaborated answers to that question. The best approach is to ask if someone is licensed to practice in that particular field. Just because a person is licensed does not, in my mind, mean good practice. However, it does mean that they are obligated to conduct themselves in a professional manner according to the state boards that license them and have met essential training requirements to be licensed. For the purpose of this talk, psychotherapy can be divided into psychodynamic therapy and evidence-based therapies like cognitive behavioral therapy. When I say psychotherapy, I am also talking about psychoanalysis. They are very closely aligned with each other. And that's hard to explain, but they are. And ever since they took away the frequency rule, they're very closely aligned with each other. And I also like to talk about modern psychoanalysis because that is, and in my mind, I differentiate that from other practices of psychoanalysis because Heidman Spotnitz had a certain theory about what caused mental illness and certain treatment techniques in order to work with it. So I do elaborate on that in my videos on what makes for a good psychotherapy session. To me, psychotherapy is just as much an art as it is a science. However, that's been hotly debated. I like to think of it as an art in terms of free expression and following one's free associations rather than like many CBT therapies, they have workbooks and assignments. It's not my style. That's not how I was trained, but that doesn't mean it doesn't work for some people. Psychotherapy has been on the defensive when compared to CBT and other psychotherapies. It's changed now, and it's changed with this particular paper that was completed by Dr. Jonathan Shedler. This was in 2010, called The Efficacy of Psychodynamic Psychotherapy. Dr. Jonathan Shedler, 2010. Quote, empirical evidence supports the efficacy of psychodynamic psychotherapy. Effect sizes for psychodynamic psychotherapy. An effect size measures the strength of any particular phenomena. Those So the effect size for psychodynamic psychotherapy were as large as those reported for other therapies that have been actively promoted as empirically supported, quote unquote, and evidence-based, quote unquote. Additionally, patients who received psychodynamic psychotherapy maintained therapeutic gains and appeared to continue to improve after treatment ends, I think as compared to some of the other therapies. So this is the internationally acclaimed article that established psychodynamic therapy as evidence-based treatment. That was published in the American Psychologist. I'm going to have that paper online, so if you go to marksehl.com, you can download it and read it for yourself. It's a very interesting paper for those who want to gain some understanding of what went behind this study. So choosing the therapist. How do you know you have the right one? Well, you're not going to know until you try it out, in my opinion. No amount of information is going to substitute for your own experience. However, in order to find the right therapist, what are you going to do? Well, you can ask a friend, your general practitioner, the internet. Google your location and psychotherapist and see what you find. Read what the website says. Many therapists have websites, and you can get some feeling of who they are and what they consider important information to convey to people by reading their site. Perhaps something about the combination of a picture of the therapist and the site content will help you make a decision. When I was in social work school many years ago, there was a student who I admired very much. She was a lovely person, and I was thinking about therapy at the time. I had a major anxiety attack where I walked from Greenwich Village all the way up to about 90th Street. And I was unaccustomed at that time to experiencing anxiety, but that threw me for a loop, to use the vernacular. So I wanted to go into therapy. And I liked that person very much, so I said, "Who is your therapist?" So I went to him. Some of the treatment was great. Other aspects were not so great. He had a alarm that you use for cooking, to tell you when a roast is done. So he would put that alarm in a drawer, and it would buzz at 45 minutes. And I was uncomfortable with that, but I never didn't have the gumption at the time to say anything about it. I was young. Didn't have much psychotherapy under my belt at all. He also said at one point that his accountant said that he needed to raise my fee. So putting those two things together, I felt that he did not want to take responsibility for certain things, and also maybe reflecting back on it, he might have had a problem with his own aggression and assertiveness. So, but he was a very decent person, and I got a lot out of the therapy. So not everything is ideal. It's not a perfect world. I was interested in psychoanalysis, so he did give me a chance to lay down on the couch. He didn't have a couch in his office, but he said we could use the group room, and that was nice of him to be able to practice psychoanalysis, even though he wasn't a psychoanalyst. So good for him. But I did finally go to see a psychoanalyst. So shop around and interview a few therapists. Shopping around can also lead to being a resistance to finding a psychotherapist. You can shop and shop till you drop, but you don't find a psychotherapist. So you might be anxious, you might be just too anxious to really settle in to start to work with somebody, but try not to shop around too much. Sometimes you just have to wade in the water and try it out. You can always stop. Ask if you can have a free consultation. In my practice, I don't charge for the first consultation unless we agree on a fee and we agree to work together. If we do those two things, then I will charge that fee for that session and subsequent sessions. If not, I don't charge for the first session. And in that way, people can try therapists and they don't have to spend a lot of money until they settle down with one particular person. Well, that's my policy. Other people work that way, some people don't. They charge for the first session. One advantage people have in coming to this channel, and if they are looking for a therapist, and by the way, if you are and you want to see me, I invite you to contact me. They can tell by how I work by watching the videos on what makes for a good psychotherapy / psychoanalytic session. I have 17 videos up there. That should give people a good chance to see the ins and outs of where I fumble around and what I have to say, and if what I have to say has any resonance with you in helping you to understand psychotherapy. Here's one quote from a Therapy for the Heart follower. "Thank you for posting your videos of therapy for the heart, on YouTube. I'm going to start therapy with a psychotherapist and was a bit nervous about it. Seeing your videos convinced me of the need to go into therapy and also has removed some anxiety. It has also given me insight into what I'm looking for in a therapist." Another quote, "After viewing 2 of the videos, I appreciate how you bring the material down to earth while still not sacrificing its academic nature." That was a big compliment for me. I have a passion for a lot of things. One of this is doing my videos, and that last quote was very meaningful to me and a wonderful compliment. Reflecting on my years of training, over the course of my training, often the course material was on a cerebral level only, very intellectualized. That was missing something for me. So the observation that I bring the material down to earth while still not sacrificing the academic nature means that I have succeeded in accomplishing my mission with this channel. My challenge was to create Therapy for the Heart, was to help people understand psychotherapy and psychoanalysis, particularly modern psychoanalysis. If you listen to talk 3, that differentiates modern psychoanalysis from classical psychoanalysis, and there is a difference. I'm not the only person who talks about psychotherapy on YouTube. There are many. So if you want other people's, listen to other people's talks, you can Google psychotherapy on YouTube, and you'll find many different people talking about psychotherapy. So see how you feel about their talks. I happen to be on the first page because I've worked very hard to get there. But there are many pages about psychotherapy if you go on YouTube. I don't know how many, 10,000, something like that. I can't remember now. Keep in mind that not every therapist, if you're looking for family, couple, or group therapy, ask that question before you call so you don't waste your time. I happen to do family, couple, and group. I have a group that I run. I also do a group of where I train people in psychotherapy and psychoanalysis. So if you're interested in that, you can contact me also. It's a very good group, and people really learn a lot from each other and learn about their own personal self and how that self interacts with the patients that they work with, which is the most helpful thing that I think training can provide. So contact me if you're interested. I'm going to sign off for now. This is Mark Sehl from the YouTube channel Therapy for the Heart, and I'm going to continue with part 2 of this talk on choosing a psychotherapist, psychoanalyst. So I appreciate you listening to me today, and remember to like the channel if you can. Press the like button, and comment and subscribe to the channel. It's easy to do. Just get a YouTube account, a Gmail account, and you can open up a YouTube account. You don't have to have any videos to do that, and also then you can comment and subscribe. So thanks a lot for listening, and I'm going to continue with part 2 right now.